My name is Robin. I'm a student nurse from Okanagan College. And what's your name?
I am Howard Robin.
Yeah. Okay.
Dad.
Is it okay if I sit here?
Yeah, totally.
Yeah. Okay. And what's the date today?
It is October 9th, 2005.
Yeah.
2025.
Yeah. And what's your birthday?
October 13th, 1965.
Okay. And then I see on your wristband there too. Okay. And so you mentioned you used to be a high school teacher.
I did, yes.
Yeah. Oh, nice. Okay. And I have read and I have been told that you are progressing quite well after your hip surgery.
Yes.
It's been going well?
Yes.
Yeah, great. And so you are scheduled to be discharged from the hospital in about 72 hours, which is 3 days from now. And you're going to be sent home with some medication that you're going to be needing to take yourself on your own when you're at home. And I'm here to do some teaching about that medication. Okay, is this a good time?
Yeah.
Yeah? Okay, so I gave you a pamphlet earlier today, and oh, great. Okay, good. And then have you had a chance to read over the pamphlet?
Yes, I have.
Yeah, okay, so and that's a pamphlet about the Nadroparin. That's the medication that you're already on and you will be taking once you go home.
Okay.
And then I also gave you a link to a video for you to watch on your phone. And have you had a chance to watch that video?
Yes, just recently. Yes.
Okay, great. Very good. So both of those, you can keep these, the pamphlet, and you can keep the video link, of course, and so that you can reference those for when you go home if you need to be reminded of any information.
Okay.
Or you can also contact us. And do you have any questions so far?
No.
No? Okay. And do you know why so this medication, the Nadroparin, do you know why you're taking this medication?
Kind of.
Okay.
A little bit. It's
tell me what you know.
Preventing blood clots and blood thinner because of my surgery that I had.
Yeah, perfect. Excellent. So yeah, you were started on this medication because of your hip surgery, and then we needing to continue this medication for 14 days in total. So that's why when you go home, you still need to be taking it to prevent those blood clots. Okay. And then have you ever done any injections before?
No.
No? Okay. So we're going to go over, I'm going to go over the steps that you will be doing. So we can put those papers just to the side for now. And then I'll be going, teaching you how to do the steps and how to do this injection.
Okay.
Okay? And so we will be preparing, so we have hand sanitizer here. So you want to do we'll call it hand hygiene. So yeah, so 20 seconds to 30 seconds, probably 20. And then we'll let your hands air dry. And then you will be assessing your site. So your site is going to be from your belly button, and then 2 inches around your belly button, you're not going to inject in that area. So anywhere around this area, away from the belly button, is where you're going to be injecting. And then you will be grabbing a pinch of skin, and you'll be holding that when you do your injection. And you can keep your shirt up for now. Is it okay if your shirt's up? Yeah. Okay. So then what you're going to be doing is you're going to be taking an alcohol swab. And you're going to be swabbing the areas. And we're looking for any previous bruises or any scars. And we don't want to be doing over top of bruises or scars. And so that area is fine. And then you're going to be taking your medication one of your medications that you've had at home. This is a pre-filled syringe, so it's already set up and organized for you. So you want to make sure that you just want to check and make sure that it's the right medication. And yes, indeed it is. And you want to make sure that it's the right dose. And your dose is 0.4 mils. And so you just want to take a peek just to confirm. You may see an air bubble, and that air bubble is fine. No, you don't need to worry about the air bubble. So then you want to make sure this pink safety cover is down for now. And then what you're going to do is you're going to remove the cap, and then there's a little small needle. So then you're going to pinch the skin. Well, in this case, I'm going to pinch it with this hand.
Mm-hmm.
And then you're going to inject at a 90-degree angle. And then you're going to push the medication in slow. Wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you remove, and then you can release, and you can relax. You can put your shirt down. And then you're going to push this safety cap up. And once that's covered, then you're going to dispose of this in the sharps container, in a special container for sharps. So we would dispose of that over there in a sharps container. And after you've done your injection, then you'll want to monitor yourself for any signs of allergic reaction. So some of the signs of allergic reaction could be your tongue swelling up, your throat swelling up, made a big rash. And so if you experience that, it's you need to seek immediate medical attention. Okay. The other thing to look for is if you have large amounts of bleeding. So if your bowels are bleeding, your bowel movements, or you have blood in your urine, or if you have big bruises, and so that's definitely seek medical attention. Okay. So far you've already been on the medication, and none of that has occurred, and so you should still continue to be fine while you're at home. But you never know. Things can change, and so those are really important to know.
Yes.
How do you feel about this so far?
Pretty good, actually. Pretty good.
Okay, good. Do you have any questions so far?
Not really. I do have one.
Sure.
I saw on the video that there is other spots that I can inject from, and that I should regularly move around the spots because it can cause bruising or something if I continue to go in the same spot.
Yes, you know what, that is an excellent question. So yes, it's important to what we call rotate the spots. So if you've done today's injection here, you want to rotate and go to tomorrow's injection here, and you can go different spots. You can also inject in your thighs, your upper thighs, or you can have someone inject the back of your arms, or certain specific spots in your back. But someone else has to do that for you. So if it's just you doing the injections, you'll want to concentrate on your thighs or your abdomen. I recommend just sticking with your abdomen and rotating, so moving them along. And definitely not over top of a bruised area.
Yes.
Yeah, very good question. So, are you ready to do it yourself?
Yeah, sure.
Yeah, okay. So, what would be your first step?
Hand sanitizer.
Okay.
And you would get some hand sanitizer, and you would rub it in for about 20 to 30 seconds, and then let it air dry.
Okay.
Then you would lift up your shirt, because when you do that, grab the alcohol swab, I'm not going to rip it, and use it on the area, away from just a few inches from your belly button, I think.
Okay, good.
Then I'm going to take this, and I'm going to look and see if it's the proper medicine, because you need to look at these things. And see if it's the proper dose, and make sure that this is lowered. I would pop the cap off, but I'm a little bit afraid of stabbing myself.
Yeah,
so
we're
not going to do that.
Yeah. For your demonstration, we'll leave the cap on.
And then I'll take this. 90-degree angle, and slowly push it in. Wait about 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remove it. And put the thing on. And put it in the sharps box.
Yeah. Excellent.
And put my shirt down because,
Yeah, that's fantastic. And do you remember what some signs would be that you would require immediate medical attention? So what are 2 things that you would be watching for?
If I have an allergic reaction to it, like swelling of the throat, crashing, or excessive bleeding.
Mm-hmm.
That's, I believe, all I remember.
Yeah, and for the bleeding, what areas would you be looking for? Like what?
The bowels mostly.
Yeah.
And the spots. I would guess around the area.
Yeah, yeah. Yeah, and in your urine,
In my urine.
if you have
yes.
blood in your urine, or a big bruising.
Ah, yes.
Big bruising.
Yes.
So yeah, we definitely want to watch for that.
Mm-hmm.
Okay, great. So we're going to be, you're still here for another 3 days.
Yes.
And so for the next few days, I will come back in and we'll review this teaching.
Yes.
And we'll review all these things that we talked about today. And so that you're really prepared for when you go home.
Okay.
Do you have any questions?
No, I think I've pretty good.
Okay, great. Thank you.
Yes. Thank you.